One of the things that has significantly changed or directed the course of my career has been the understanding that the types of conditions that we focus on, being jaw pain and face pain, require a multidisciplinary approach in order to adequately address all the moving parts. And so with that understanding, I have made it my mission to try and understand the viewpoint of other professionals who may be involved in the management of these conditions. My name is Darron Goralsky. I am a physiotherapist, originally from South Africa. I've been in the industry over 30 years. I am the clinical director and the founder of Melbourne TMJ and Facial Pain Centre. We're a clinic that focuses predominantly on jaw pain, face pain, and headaches. When I first arrived from South Africa, having worked in a clinic which did treat jaw pain, I was under the impression that I would find the same thing here in the physiotherapy industry. To my surprise, though, there were very few physiotherapists or osteopaths treating jaw or face pain, and it was mainly the dental profession who were tasked with that responsibility. That led me to really try and understand the viewpoint of the dental world in how they thought that these conditions should be best managed. And it became clear to me that temporomandibular disorders, which is just the umbrella term for these conditions, has a very large musculoskeletal component to it, albeit that the teeth can be involved, and we know things like stress and posture impact. At the end of the day, it's the joints and the muscles that are usually responsible for producing the pain associated with these conditions. And so I couldn't understand why there wasn't a physiotherapeutic involvement in the management of these conditions, albeit alongside a dental approach. And so I became really interested and passionate about changing that. And that led me ultimately to developing my own clinical approach and establishing Melbourne TMJ and Facial Pain Centre, initially just offering physiotherapy, but over the years as we've evolved, we've recognized the need to have in-house specialists from the dental world. We have a GP who specializes in the use of Botox for recalcitrant conditions, and we have a functional breathing educator because we understand the role of breathing and the nervous system in these conditions as well. The challenge that I was faced with was that as the clinic became more widely known and busier, so my clinical hours grew to around 60 hours a week. And 18 months before my 50th birthday, I recognized that I was on a path to burnout, something that can be really common in the allied health world where we're trading time for our income. And I made a decision to change course with my business approach to the extent that I needed to train others in my clinical methodology and ultimately allow myself to stop consulting so that I could focus on supporting my team, which is what I managed to achieve about 7 years ago. Two things make this a unique joint in the body. Number one, you only have one mandible bone that serves both the left and right jaw joints. So in effect, if something is happening on one side, it's going to impact what's going on the other side. The second thing that makes this a unique joint is the fact that there's teeth at the meeting interface, which is why there's sometimes an assumed dental connection with TMJ problems. And we used to think that that TMJ problems were related to somebody's bite. We know that not to be the case. There are certain bite types that might predispose to TMJ issues, but TMJ issues are much more a result of overusing or misusing the structures around the temporomandibular joint. So it's a musculoskeletal injury, and that's why we would get lots of dental referrals once the dentist has ruled out a dental cause. One of the things that has significantly changed or directed the course of my career has been the understanding that the types of conditions that we focus on, being jaw pain and face pain, require a multidisciplinary approach in order to adequately address all the moving parts. And so with that understanding, I have made it my mission to try and understand the viewpoint of other professionals who may be involved in the management of these conditions. I'm very passionate about the field that we're in and the fact that we are leaders in this area clinically, and that we have people on our team that are on the same journey as us. It's so rewarding to see a new therapist join our team and develop skills that ordinarily they wouldn't have had from their base training or from experience in other clinics. And we get so many wonderful reviews from patients thanking us profusely for changing their lives. It's very, very rewarding work. And having stepped into a non-consulting role where I can focus on supporting my team and expanding our clinical offering and educating beyond the clinic, is very rewarding to me. I've never loved my career as much as I love it at the moment. I've been involved in education for a number of years, whether it's lectures at conferences or in-service training for GPs or dentists at their clinics, as well as training our team internally. A number of years ago, I started running a 5-hour masterclass in the management of temporomandibular disorders for a dental audience. And this was as part of a 6-day mini residency delivered by our principal dentist. He encouraged me to actually develop my own course. This has been a goal for a number of years. And only last week we ran our 2-day course, an intensive course with practical skills for dental professionals. And it was an exhausting process in the lead up to get all the content locked down, but it was very, very rewarding. The feedback that we've received has been amazing, and I'm hoping that it's going to be the start of me educating dental professionals to, if not treat, but at least better recognize these conditions for what they are and know what the appropriate management should be and who to refer to or collaborate with. In our sector, working specifically with these conditions, we're definitely seeing a trend towards more of a multidisciplinary approach. And I'm part of a number of different associations that recognize the need for collaborative care. So there is an awareness of things like the role of the nervous system, the role of sleep in how we perceive pain, how we respond to treatment. And it's encouraging to see that this awareness is growing and that people are wanting to collaborate rather than practicing just in their own silos. My advice to anybody looking to get into this sector is to be inquisitive and to think outside of your own professional training. And what I mean by that is, if you're a physiotherapist, collaborate with people that are not physiotherapists, that have a different viewpoint on the same conditions that you may be treating. And this has been key for me to be able to broaden my understanding and my scope. And that has allowed us to then increase our clinical offering to better service these patients. So be inquisitive, give yourself permission to focus in on one area of practice that you feel you excel at, and go as deep as you can to try and uncover things that you may not have understood before. I think my passion is driven from the sense of gratitude that I get from patients who say that we've changed their lives for the better. And it fuels me to want to continue to improve on our clinical offering so that we can empower patients to really make changes and be in control of their own health. So for me, that is probably the biggest thing fueling the passion for the work that I do. I love photography. I also love travel. And so the intersection of those two is something that I look forward to combining more than once a year now that I'm not consulting and I'm not bound to the clinic room. And my other passion is for my dogs. We have two beautiful little cavoodles who are definitely the most important people in our family.